Welcome back. The saying goes, you're only as young as you feel, but can your body be older than you look? Reporter Viv Williams looks at how artificial intelligence is helping Mayo Clinic experts measure heart age and what you can do to close the gap.
What is it about those people who look like they're in their 40s but are actually much older? Maybe they just have good genes. Well, that could be. But the myth is, if you're not one of those people, you just have to live with it. Well, experts from Mayo Clinic debunk that myth by comparing people's real age to their heart age. They use artificial intelligence to analyze echocardiograms, or ECGs, to determine how old someone is according to the health of their heart. The researchers then compare that number to the real chronological age of their patient.
When the computer is telling us that this individual is older than what this individual truly is in terms of years of age, we have seen that those individuals die sooner.
Dr. Francisco Lopez Jimenez, a Mayo Clinic preventive cardiologist, says that, on the other hand, if the technology determines someone's heart is younger than their chronological age,
those individuals live longer and have less heart attacks and less heart events of any type.
So what should you do if you find out your heart age is actually older than your real age? Well, Dr. Lopez Jimenez says you can narrow or even eliminate that gap by making some lifestyle changes.
It doesn't take long.
Lopez Jimenez says you can make a difference in as little as a week.
What we are doing these days is to use this information to motivate people to change behavior, to exercise more, to stop smoking, to worry less, to work on their stress level.
Lopez Jimenez says by working on those factors, you can reduce the age of your heart and improve overall health.
I have an uncle, he used to always say, change behavior requires circumstance.
Okay.
And I thought that is so deep.
Okay.
That's true. So that's what you're seeing here. You're seeing what your heart age is. And there's a lot of tests out here that'll show biological age, and they test it based off of different parameters. Some of them are looking at inflammation and the immune system as to how much you're aging. A lot of them give you your biological age and your chronological age. And so I look at it when I see people that say, man, he was so young, he just dropped dead at age 50. Now I understand his chronological age
was 80.
Exactly.
Right.
Yeah, but we have the testing now to know. Not only can we look at the age here, we also have testing that tells us about different organs and how they're going to age and the pace. So it just gives us a nice way to intervene.
Right. Yeah. And genetics play a part, but lifestyle plays a huge part as well.
Yeah, I loved it when they said it only takes a week. I thought that made me feel so hopeful. Like it doesn't. You're not looking at it felt so much like underwhelming.
I think it depends on what all the other factors you have going on, though, too.
Yeah,
I mean,
yeah.
There's a lot of people that think it's just too late to make a change.
Right, and it's not.
It's never too late.